Well, February is Heart Month, and we're going to learn more about the role of a surgeon and some of the surgeries to help with our heart. Joining us today from Mercy Health St. Rita is a cardiothoracic surgeon, Dr. Lico. And thanks for joining us today.
Good morning, Holly. Thank you.
All right, so let's talk about this. Your role as a surgeon when it comes to heart health and stuff compared to like a cardiologist. How is there a difference?
Well, very simply, surgeons treat the heart with surgery, whereas the cardiologists treat it with medicine. And so I'm usually the last person that a patient would see when they try medical intervention that's not successful or other types of less invasive interventions, catheter-based interventions that aren't successful, and they need open heart surgery.
Okay, so let's talk about open heart surgery then. What exactly is that?
Well, it's actually exactly what it sounds like. To do things to fix the heart, you have to open it. And it means opening the heart and fixing things. For instance, a valve. A valve may be leaky or it may be very tight. And to get in there and replace a valve or repair a valve, you have to open the heart. To do that, obviously, you need to stop it. And we have special machines that take over the function of the heart and the lungs while I'm able to operate on the heart. So people think of open heart surgery as typically a valve surgery. There's also bypass surgery, which is another component of that.
So bypass, I think you're working around clogged arteries, is that right? I mean, explain bypass. I'm not a doctor. You explain that.
Technically, we don't have to open the heart for the bypass surgery. The arteries for the heart are on the outside of the heart. And if you were driving down the road and the road was blocked, you'd have to go back and take a detour, right? So what I do is provide the detour. And I would obviously need tubes, conduits from other parts of your body. We use a vein from the leg and an artery from the chest wall and create a bypass or a detour around the blocked arteries to the heart. We typically do that when stents don't work or you can't clean out the arteries and the medicine's not working. So there's usually multiple arteries involved, and it creates an alternate way of blood flow to get to the heart.
Okay, so we're talking about your heart, major thing that you need. What are the risks? I mean, do you find that your patients are a little bit nervous when they're coming in for surgery?
Yeah, everyone's a little scared, but typically these patients have seen many doctors before they get to me. They've often tried medical management with a non-interventional cardiologist. Then they've seen an interventional cardiologist where they may have had some stents or some other types of procedures done. And so they're mentally prepared, but they're scared. And because they've always, many of them heard bad stories. It's really not a high-risk operation. Most of the things that we do are pretty routine, and the risk is quite acceptable. The surgery is done basically for two reasons: to make you live longer and to make you feel better.
And those are awesome reasons. So what's the recovery like from the kind of surgeries that you do?
People generally spend about 4 or 5 days in the hospital. The next month, they have to take it easy. And that has to do more with healing the incision. The heart is completely better by the time they're going home. We wouldn't send anybody home unless their heart was completely fixed, so to speak. But the sternotomy and the incision takes a little bit of time to heal. And that bone needs time to knit together and grow together. Mm-hmm. After that, we actually start people on an exercise program. It's called cardiac rehabilitation. And then within about 6 weeks, they're back to normal. The surgery is not disabling. In fact, we would expect patients to get back to their normal daily activities, all the fun things that they do, working, having a good quality of life.
Right, feeling much better and everything. I mean, through the years, have you seen changes and improvements in heart surgeries and the outcomes and the way things happen?
Yeah, that's a great question. A lot of the things that the interventional cardiologists do and the surgeons do are coming together. And so we join forces. So often we do hybrid types of procedures for patients where they may get a minimally invasive type of intervention along with the surgical intervention. And so we have a heart team here at St. Rita's. We talk about all the patients together, the medical doctors, the interventional cardiologists, and the surgeons, so we can tailor the treatment that's best for the patient.
Wow, fascinating stuff for us to learn here during Heart Month. Thank you very much, Dr. Lico, for joining us.
Pleasure, Holly. Thank you.
All right, don't go away. New Edition continues in a moment.